How is Asian blepharoplasty performed? Possible ptosis or just swelling? I read that it takes 5, 7, 10 days for Asian upper eyelids to look presentable. I'm 12 days past the surgery. I'm wondering whether it's ptosis or the surgeon took out too much fat and unfortunately resulted in a hollow appearance. I'm extremely upset and regretting my decision for Asian blepharoplasty. Please let me know how long swelling will likely take to subside. Does blepharoplasty involve taking out a lot of fat from the eyes? Is dryness a permanent condition?
Thank you for your question. You presented in your question a lot of the typical questions that people have after Asian eyelid surgery, and certainly you've done a lot of research and you're asking questions about ptosis. This is a photo you submitted, I believe, at about 12 days after your surgery, and you're asking about whether too much fat is removed, whether you have ptosis. So I think that this was something that probably was discussed during your preoperative evaluation, but certainly it's something that can be reinforced. And I'll share with you how we discuss the recovery period of Asian eyelid surgery with our patients. So let's begin with what makes the Asian eyelid surgery recovery period a little bit longer typically than for a non-Asian eyelid procedure. And essentially, there's some anatomic factors and some procedure that has to do with probably why an area of the eyelid we call the pretarsal area. Now, the pretarsal area is the space between the eyelid crease and the eyelashes. When Asian eyelid surgery is done, and this is a person who has, let's say, a little bit of extra skin or almost no extra skin, but has fat that is actually blocking the connection between the levator muscle, the muscle that lifts the eyelid, like the word elevator, and the fibers that would create a crease, okay? So you asked about fat removal. Well, when we do Asian eyelid surgery, very often we're not actually removing a lot of fat, because the more fat you remove, the more relative hollowing you can get. But rather what we do is we look to see if the fat will get in the way of the attachments that we're creating surgically. What we're essentially doing is we're taking the skin between the crease and the lashes, and we're connecting it to the levator muscle. And so that creates a little bit of a tight compartment. And essentially what generally happens is there's swelling, and that swelling typically takes time. So when I see my patients, usually I see them closely in the first few weeks after the surgery to help them feel confident that what they're experiencing is normal. So it is normal to have swelling from the crease to the eyelashes. In some people, that swelling can last for several months, and subtle degrees of swelling can make a huge difference in the appearance. So a lot of times, people will feel panicked that the crease is too high, because the swelling of the pretarsal area causes the eyelid crease to look higher. So I always explain that where you are at 1 week, 2 weeks, 1 month, 3 months is going to be an evolution. Now, if there are other factors such as sinus issues or allergies, or even allergy to the antibiotic ointment, these are things that can certainly prolong the swelling of the eyelids. So it's very, very important that you communicate with your doctor and not jump to conclusions about your appearance. Certainly people can look like they're hollowed out in the beginning. This is an area where there's a dynamic architectural change that what I like to do is during the surgery, in some patients, and actually for most patients, when we're doing the procedure, we'll actually have them open their eyes to take a look to see how the eyelid creases in. It kind of gives us a window of opportunity to identify if the eyelid crease looks the way we intend it to look. If it looks good during surgery, then it'll probably look good after surgery. There's always exceptions, and revisions are sometimes necessary. It's just a part of cosmetic surgery. But in your situation, I would suggest to you that you're probably a little early in drawing your conclusions, and that you should communicate with your doctor about what your concerns are. And your doctor has your photos of you before surgery and can review with you what you can anticipate. But it just seems that your concerns are consistent with the typical healing process related to Asian eyelid surgery. But no one would know better of exactly what happened during surgery better than your surgeon. So communication is always very, very important. So I hope that was helpful. I wish you the best of luck, and thank you for your question.